From one emergency to another, NHS leaders making that link between rising energy costs and pressures on the NHS. In a rare intervention on energy prices, they wrote to the government today, warning that if people can't afford to heat their homes and if they can't afford nutritious food, then their health will quickly deteriorate. And without urgent action, we could face a public health emergency.
It is frustrating right now that our politicians don't seem to be focused on what's happening in the health service. But what we are clear about today is that if the government does not do something about the growing threat of fuel poverty, the growing threat of people not heating their homes, not only will that be tragic for those people, but many of those people will then present to the health service, and that will mean difficulties, not just for them, but for all of us who need to use health services over what's going to be an extremely challenging winter.
A winter that will see the largest cut to real disposable household incomes in Britain since records began. Those suffering the most seeking help at food banks like this one in South London.
We've never known anything like it. The numbers coming through the door, even the people that used to give us food are now asking for help. And even to buying food, when they're actually getting food from the food bank, it's all like, how many minutes will it take to cook it? What's my cheapest way of actually heating this food?
The government insists action has already been taken to help families, including pumping £400 into household budgets, and they say the NHS is supported. But Lara Owen worries about record-breaking ambulance times she's experienced herself, calling 999 when her mother broke her pelvis.
It was really shocking that it was 14 and a half hours. It's sort of incomprehensible, really, that you could call an ambulance in the UK for someone in that situation and them not arrive for 14 and a half hours. It was just unbelievable. And by the time we were going through the hospital process, she was saying to me, I'm not going to get over this. The pain is so bad.
Last month in England, just over 2,000 people waited more than 12 hours in A&E. Since then, there's been a 13-fold rise. Care home staff shortages are partly to blame, prompting ministers today to admit they've been looking into a foreign hiring spree to plug some of the 160,000 vacancies.
It isn't the easiest option, it's not the cheapest option, and sometimes you have to think very carefully. It's quite expensive becoming a sponsor, getting those visas in, and it's time consuming because it doesn't happen overnight.
With the political spotlight turned on the NHS, the next two auditioning to be Prime Minister today so far unclear on how they'll get us out of this critical condition. A condition set to get worse when the energy price cap rise burns through bills in exactly 1 week's time.